Yeah, you said it, Matt. That's really troubling to see those kind of numbers. But the author of the study, he said, look, we still have time to take some steps to drive some of those numbers down. And he also said that has to depend on widespread testing.
And this is an extraordinary situation for all of us.
Anirban Basu from the University of Washington School of Pharmacy authored the study released Friday. It focused on determining the infection fatality rate based on statistics we know right now and confirms what many health officials have repeatedly warned.
This is an infection that is substantially more fatal than the typical flu that we look at.
Basu said coronavirus is literally nothing like the seasonal flu and insists those who fall ill face an alarming rate of death.
It's quite high compared to seasonal flu. It's about 10 to 13 times higher than that.
But now comes some good news for a change. UW Virology published analysis using samples from 95,000 patients and determines the peak of local infections are now in our past.
All the stuff we did, the physical distancing, the great efforts people have done to cut this virus and its spread down really made a huge difference.
Even so, researchers continued by saying all of those efforts need to continue to drive down the number of new infections. Basu is also a PhD in healthcare economics and says the best way to eliminate coronavirus spread and to get our nation's economy back on track is to expand testing far beyond the current efforts.
And how do we make it visible? Is to actually figure out which neighborhoods has the most clustering of the virus present. And the only way you can do that is to go neighborhood to neighborhood and do serotesting, some random sampling, maybe pull those sample and get the test and kind of identify neighborhoods and then focus the public health efforts in those targeted ways.
So just this afternoon, King County health officials tell us they're now seeing an increased viral transmission rate compared to just about a month ago. That information also shared with us. They're seeing Eastern Washington's population struggle with a persistently higher transmission rate. Those King County health officials mentioned all of this is likely going to continue and social distancing will need to improve before some of these restrictions can be removed. Steve Kiggins, Q13 News.